So what does that mean for you if you're not a healthcare provider? I will tell you what I told my family. So I called everyone a couple of days ago and was like, all right, team, let's have a chat. No more going out. Try not to go to the grocery store. Look into delivery. For my parents, like we had some really intense discussions. They weren't super intense, but they kind of led into some stuff. I am, kind of a straight shooter. So what I told them is that if you can avoid going to the doctor right now, I would. If you can avoid, because those people are people who are seeing multiple people, way more people than you are staying at home, maybe even more than you are going to work, depending on the size of your office and what your work situation is right now. And so if at all possible, cut it out. So don't go to the PCP right now for your annual checkup. Cancel it. A lot of people are already getting them canceled regardless of by your provider. But even if your provider is not canceling, take it upon yourself to protect yourself and the people around you by deciding that your annual visit can wait, if it can. Physical therapists, right? Like if you're going for this weird tennis elbow thing that you've had for a really long time, and now is the time that you were going to get rid of it. Maybe wait on that. Reach out to them though. See if they've gone online. A lot of people are going online. So reach out to your provider and say like, hey, I don't want to come into your office, but can we either connect on the phone? We go over my home exercise program and make sure that we got things going well? Or, do you have telehealth visits available? And if you're sick, definitely don't go I don't recommend going to get tested, to be honest with you, because one, we're short on tests nationwide. And two, you're putting yourself in a situation, and this is of course, if you can avoid it. There's some things about like, if your employer will only pay you if you for sure have it, right? That's going to throw a wrench in things. Employers also stop requiring that. But you're going to go sit in a waiting room with other people who think they have it, some of whom certainly have it, right? So avoid the testing centers if you can. That being said, if you become short of breath, or if you have other comorbidities, so other things going on in terms of like immune stuff or respiratory things, call your doc, call your PCP and say like, hey, these are the symptoms I'm experiencing, what should I do? And they'll be able to better guide you through how to do that. So that's what I told my fam, and that's what I'm telling you now. That being said, similar things apply, right? So if you have the type of pain that you yourself are afraid that you're going to turn to drugs and alcohol to take care of, especially during this really challenging time, self-awareness is super important. Reach out to someone about that. Start with somebody. It doesn't have to be a physical therapist. It could be a behavioral health provider. It could be a close friend. Keep tabs on it though, because we know that during really stressful times, people do see an increase in pain. So just make sure that you have a healthy way to deal with that. Feel free to reach out to me. I'd be happy to, if you don't have anyone else, I'd be happy to give you suggestions. If you recently have had a surgery, you're post-operative in some way in the last 60 days, I would definitely recommend continuing to at least reach out to somebody and getting good advice. If you are elderly and afraid of falling, and especially though, if you are afraid of falling, please, please, please reach out. But don't go out. If you can at all avoid it, call ahead beforehand, see what can be done virtually. And if you are newly postpartum, or you're a mom or a nurse or a caretaker or any of those people that we were talking about earlier, and you feel overwhelmed by the number of people that you are taking care of and do not feel like you yourself are being taken care of, you should also please reach out to somebody. Again, I recommend starting at least virtually and seeing if things are possible online. Frankly, you're not going to have enough time to go into an office anyway, so and if you did, you'd probably have to bring your kids, and a lot of places aren't allowing kids in or more visitors, so it just is one less thing for you to have to deal with. Just do it from your home. So there are certainly people, again, who should continue to receive care at this time. I know that if you follow other physical therapists at all, and a lot of other providers as well, that people are talking about telehealth, people are selling you telehealth, and it's great. It's a great option. And I also recognize that now might not be the time that you're really that concerned about it, right? Now is maybe not the time that you're thinking, yeah, I really need to get this thing fixed. This can wait. Your finances are probably up in the air. Your job's probably been impacted. Your partner's job, if that's your situation, has probably been impacted. If you have kids, they're home and going through food at a rate that like just seems not possible. So it's okay if now is not the time to be in your best peak physical health. It is okay if now is the time that you are not in your best peak physical eating or fitness or any of that. All of that is totally fine. And this is very likely going to last way longer than any of us want it to last. And I recommend that you consider not waiting for the whole time. I recommend not waiting to take care of yourself until you're in a position where you can no longer ignore it. I feel very weird about offering telehealth services. I haven't really talked a whole lot about them. Sorry, I don't feel weird about offering the services. I feel weird about trying or feeling like I'm coming across as trying to sell right now in a time where I think that everyone's priorities are very understandably and very validly elsewhere. And I do think there are people out there that I'm really worried about that I would hate to not know that I could help them. And so I just don't want you to be in a place or end up in a place where you can't ignore what's going on anymore in your own body, in your own health, and your own wellness, and your own pain, okay? So that's what I'm doing. If you have any questions about it, please reach out. And I hope everyone stays healthy and well.